Where all do you guys work? I know I have OB people, med-surg.
ED.
Okay, so we have a variety.
ICU.
ICU. Okay, we have a good blend here. Good blend. Okay, so this station is about safe sleep. And you might be thinking to yourself, well, yeah, you work in OB, that's for you guys to pay attention to. I don't need to pay attention to that. Well, guess what? We all get to pay attention to it. So in the Women's Center, safe sleep is just kind of a part of what we do. It's really just woven into every day. It's just kind of part of our culture. Safe sleep became a really big deal, probably I think about 2011, 2012. We found out from some KDHE statistics that Kansas infant mortality rate was really high in the nation, and within Kansas, Geary County was one of the highest. So it's kind of how Delivering Change was born. We started pooling together with people in the community and decided we needed to do something about it. So that's kind of when we started focusing on safe sleep. In 2015, the hospital received a Gold Safe Sleep designation, which basically just means that there's bronze, silver, and gold. And we were the first one in Kansas to get the gold, and right now I think we are the only ones that have maintained that. So it's just basically saying that we are elite in being able to educate our patients, that we're using practices like the sleep stacks and a lot of different, we have policies in place that are addressing safe sleep. So when we talk about safe sleep, American Academy of Pediatrics designates an infant as less than a year. So that's what we're talking about, is our less than 1-year-olds. Peds patients kind of throughout the hospital, they come in droves. Sometimes you have a handful of them, sometimes it's hit and miss, especially when you're thinking about that under the year population. So safe sleep, we talk about the ABCs of safe sleep. And we want the baby to be alone, on their back, and in a clutter-free crib. So this one over here is a wonderful example of what we do want, and this is a wonderful example of what we do not want. In the Women's Center, we use sleep sacks, which is just like a wearable blanket. This one has like a swaddle component. At this time, we're not going to be able to provide sleep sacks for other units at the hospital. There's a whole process that we have to go through as far as keeping them accounted for. But the main thing is we want them to not have any loose blankets that they would be able to take and pull up over their face that could be any kind of like choking or suffocation hazard. There's nothing in the crib on this baby, so even when they're really tiny and little, they're not really moving around a lot. Some people think, I'll just kind of keep my diapers and wipes and some cute little stuffed animal that maybe the older sibling got. Just kind of have everything there right and accessible. But we don't want anything in there. The recommendation is to have nothing in the crib. You can keep everything on the outside of it. You can see that this baby does not have a hat on, and this baby does. Sometimes, especially in like your colder times during winter, people will think, oh, it's cold, my baby needs a hat. And really after about day 3, they don't. So we start them with a hat in the Women's Center. They're not really well, they're not able to regulate their temperature very well, but once they're at about day 3, for sleeping purposes, they do not need a hat. Babies regulate their temperature through their head, and so with a hat on, that just kind of caps that off, and they overheat a little bit easier, which can put them at risk for SIDS. As you can see, this baby has a pacifier. So American Academy of Pediatrics does recommend a pacifier as far as a SIDS reduction tool. They recommend it after, if they're exclusively breastfeeding, that we wait for about a month, for the first couple weeks or a month, until we have the breastfeeding well established, just so we don't interfere with that process. The reason a pacifier is recommended is because basically the sucking is helping them to not fall into that deep REM sleep, and so they're a little bit more easily arousable. So that's another factor of they're not falling into a deep sleep. Another thing that they have shown, studies have shown so a SIDS death is considered an infant death less than a year that after a complete investigation they haven't been able to find any kind of cause. So when studies have been done to compare babies that have died with a known cause and babies that have died with just SIDS, they can't find a cause. A lot of the hormones in the brain are about 50% level decreased compared to babies that they can find a cause for. So there's a lot of different research that they've been shown, but sucking with a pacifier can help paired with that would help them not to fall into that deep sleep. Okay, this baby is on its tummy, and tummy time is wonderful, but not for sleep time. So tummy time is recommended, but they have to be awake and they have to be supervised. That is kind of the quick essentials of Safe Sleep. The handout that was on your SQSS to read has all of these things, but we know that all of you other guys in these other departments, Safe Sleep is not at the forefront of your mind, probably, especially in detail, besides maybe the ABCs of sleep when you are taking care of an infant. So we want to make this as easy as possible for us to be able to be sending this consistent message no matter where a patient family is accessing care, at the same time following our policy and giving the patients the best care and education possible. So we're going to try to make this as seamless as possible for you, so you're not relying on the fact that you just have to remember all these things that you have to do and document. So these are not final. This is just kind of some ideas of what we are trying to do as far as in some of your admission assessments and your dailies, some of the ways that you document that. For instance, like the admission assessment, there will be a spot with your education. There will be a box specifically for infants less than a year that you can click and say that you're providing education to those parents on Safe Sleep. When you click that box, it's going to print this handout. This handout, along with the policy, was in your SQSS assignment. If you want to take one, you're welcome to. If you don't, no hard feelings. So it's going to go over all the components, so that way you don't have to try to remember. It's just going to shoot it out of the printer. You're going to grab it with your patient's info, and you can give it to them and walk through those components with them. We also need to be documenting like position. So we have to be documenting, showing that yes, we're putting the infant to sleep on their back. There's no loose blankets, that they're in the crib alone and not sleeping in bed with mom. So there will be boxes such as that. Sometimes when you have an infant, most of the time, parents are tired. Either in the women's center, they've just had a baby, there's a lot going on, you're in the hospital, we're in their room all the time, we're helping them breastfeed, there's meds, and there's just a lot going on. So you're tired. Especially if you have a sick infant that's in the hospital, you're worried, there's a lot of other things going on. Hospital's not the greatest place to get a lot of rest. So we know that it's understandable that maybe a mom is consoling a baby or she's been trying to feed a baby and she dozes off, and we may catch her in that. If that happens, we're just re-educating, we're removing the baby if she's still sleepy, putting the baby in the crib, and we kind of go on about our day. Sometimes we have people that are like blatantly non-compliant, and it doesn't matter how many times we have told them and we've educated them, it doesn't matter how many times or how many different people have been in and educated them, but they are still going to do whatever they want to do. And so nationally, there's been a little bit more of a push because of some incidences that have occurred with babies in the hospital. If we're having this recurring non-compliance, that we are basically going to have them fill out this form, and it's attached to the policy, that is this infant safe sleep non-compliance form. So it's essentially them saying, I have been educated, I'm aware of the risks, that I'm increasing my child's risk for SIDS, but I'm basically choosing not to follow it. So this form, along with the handout, will also be located within your unit forms in Paragon that you can print. But for this, there's going to be a box in all of your daily assessments that you can just click if there's a recurring issue with non-compliance, and it will just shoot that form out for you. You don't even have to remember that it exists until it shows up on your printer. Any questions? Once we do the Paragon upgrade, and get these finalized of what boxes there will be, that kind of thing, we will definitely let you know. Probably get an SQSS assignment so you can see the exact tab of where it's going, the exact wording, or what to watch for. All right, well that is all I have, unless you guys have any questions. And never hesitate